Hello, everybody, and welcome to Therapy Thursday. Today is Thursday, April 13th, 2023, and my name is Evan Adler. I'm a physical therapist here at UNC Therapy Services. I'm based here at the Northwest Cary Wellness Center. I am a representative of our Community Engagement Committee, and I am your creator, host, curator, sometimes presenter for Therapy Thursday, but I'm not presenting today. This is going to be a topic a little bit outside of my comfort zone, but so I'm going to turn it over to the experts on that. But before I do that, I want to thank everybody for coming. We do this Therapy Thursday, these sessions here, as a way to reach back out to the community, give some information on common topics that we feel that would be of interest to everyone out there. This started up during COVID, where we used to be doing a lot of things in person and then really couldn't make those in-person connections. So we transferred over to more of a digital format for these type of events. It's been very successful, and we've decided to keep it going. So this will be in a WebEx format today, so all digital here. For those of you who do have access and can see some of the chat functions, you can use that for asking questions during the talk. I'll be monitoring the chat and working with our presenter to get your questions answered. We're going to try to hold all the questions for the end, but if it's something a little more urgent, drop it in the chat, and I'll let Eric know about it. Right now in the chat, I'm going to put a couple of links. One is for our Therapy Thursday YouTube channel, which I would encourage you to go ahead and visit later, and you can see all of our other talks that we've done in the past. With a wide variety of topics, from running injuries to shoulder pain to pelvic health issues, arthritis issues, all sorts of different stuff. And you can go and subscribe there and see what we have available. I also put the link in for our Facebook page, where you can find out more information about upcoming events that we're doing both in person and virtually, like our Therapy Thursday talks. So I think with all of that said, I'm going to turn it over to a colleague, friend of mine, who's going to be talking to us today about back pain, a very prevalent topic. I see it all day, every day here in our clinic, and I know that Eric does too. So Eric, I'm going to turn it over to you. The floor is yours, and I'll be monitoring that chat, and we'll all catch up together at the end. Eric, take it away.
Okay, sounds good. Thank you, Evan. Let me just get the slides up on the screen here again. Okay, yeah, looks good. Well, yeah, thanks again for having me as part of this discussion group. And to give you just a little background on me, I've been a physical therapist for a little over 20 years now. And over the past 15 of those, I've spent time working in spine specialty centers. And so currently that's at UNC in the Imaging and Spine Center, which is a nice chance to work alongside the medical providers here and manage back and neck problems together, just to try to be as efficient as possible. Early in my career, I had an interest in spine mechanics, and I went for an advanced certification, the McKenzie method, or mechanical diagnosis and therapy. That's the framework that I find to be quite helpful for figuring out, based on what people tell me, the behavior of a problem, and looking at the mechanics and the restrictions and classifying it into some of the common types of issues we see, and really trying to get right to the point on the proper strategy to get ahead of the problem and to get people back on track in terms of being able to do the things they need to be able to do. Prior to working here, I was up at the Spine Center in Dartmouth. That's in New Hampshire. I had the chance to be part of a chronic pain program. And so there I got to hear stories from people who really went quite far down the road of adventure with a back problem or a neck problem. There are a lot of options out there, and how far to go with testing and what kind of treatment to seek, or can you work through it on your own somehow? It can be tricky business. So I have just a few slides prepared today. I'll talk through with you, and then happy to discuss further. Evan will keep tabs on that chat, and then we can talk a little more toward the end if we need to. So again, when a back problem finds you, there are lots of different choices. Looking for options with Google, you may find some self-help strategies, some exercise options, some stunts you could try. You want to be safe and thoughtful about things. There are many providers out there who are alternative to mainstream medicine. They can offer you different types of things, which can be a good fit for some people. This gentleman on the current slide off to the right is a professional wrestler, and I think that's just a good way to lend instant credibility to your presentation by having a professional wrestling photo on there. But we'll skip past that now. Today, we can talk through some simple self-care strategies or exercises that can help you recover actually from most types of common low back pain. So I tried to select some simple strategies that could be a combination of doable, safe, but also potentially effective that are okay to experiment with. But we'll also talk about deciding when medical attention is needed actually for examination, for looking into the details, for helping to plan next steps. Not necessarily where every episode of back pain requires complex imaging or advanced procedures or even multiple visits. Some simple things are perfectly appropriate to work through on your own. Sometimes that can spare you the pain of the process of going through all the different appointments. But then certain things, if they're emergency situations or not making sense, not getting better, it is good to get some help on those problems. And so as part of that discussion today, we'll look at some of the reasons why some of the common testing or imaging procedures would be selected, and then what are the common treatment options out there and what situations they might be most applicable for. In preparing this talk, I went through some guidelines that have been published. A lot of these are geared toward the primary care provider, just helping to make logical decisions and help people find the right path with low back problems. There are some more recent article citations. Actually, if you were to look down at that bottom link, that is information on this mechanical diagnosis and therapy approach where they've complemented the existing basis of evidence with even more studies that have been done over the last few years as we've just tried to get more efficient in helping people to pursue treatments that are worthwhile for them in terms of their time spent and their money spent on them, and hopefully protect people from going down a road that could be not productive or make things worse somehow. And one of these middle citations, the Treat Your Own Back book by Robin McKenzie, I actually find to be fantastic as a reference for patients, for people, for even fellow clinicians or physical therapists. If you really read it cover to cover, it gives quite a bit of information about how these back problems can develop. It talks about how things are built and how things are supposed to work in terms of anatomy. It also talks about how you can experience some pretty significant pain problems, even if nothing is broken or dislocated. Within that book, they talk about some of the common factors just with our everyday lives that can feed into the problems, and some things to potentially change, simple factors in terms of posture or body mechanics that could really reduce the magnitude of the issue. Within there, they have this one specific chapter, chapter 4, which is a fantastic guideline just for what sort of pain is okay to work through on your own versus what would tell you to put the brakes on a particular exercise and maybe seek some more professional input. They have an exercise program that's outlined in the book, and usually the worst thing I see is if people get the book and just look at the pictures and try the exercises without looking through the principles to help guide. So I'll just say that if you do happen to look at that, it's good to really take in all the principles, but then, they'll guide you through whether those exercises are the right fit, or, maybe it's just good foundation knowledge and then you actually need some additional guidance. And so really any healthcare provider you see will be thinking at first, is this actually some kind of emergency situation, not the typical back pain somehow? These situations are rare, but some of the questions you'll get from a physician, a physical therapist, they'll be along these lines just to try to rule out the possibility of something that needs more immediate medical attention. And so basically, if you've been in a major accident, you've had a trauma, and there's a chance that something really could be broken, that is not the sort of thing you should just try to gut it out and work through. So if you've had a major fall, been in an accident, something like that, that is good to get checked out to determine, what's the story, and then how does that need to be managed accordingly. You'll often be questioned if you go for a medical or physical therapy appointment about the function in your legs. And it feels kind of funny if you're there for your back, where there's so much attention to my legs. Even some of the physical testing, we're trying to determine, is there some compression on the nerve roots in the back that is actually causing you to lose function, and especially if it's a rapid deterioration of the strength, really day after day or week after week, it's harder and harder to move your legs in specific ways. Those are the kinds of things also you don't really want to necessarily be patient with or work through, but you should go have that examined to see if there's some compression of nerve roots that needs to be addressed somehow. And then this is a big deal if somehow you've just had this back pain, and along with it, you've lost complete control of your bladder or your bowels. And that's not just to say, some minor changes in habits, but really a complete loss of control. That's also potential compression on some of the lower nerves in the spinal canal. And that's something you'd want to get immediate medical attention for. Sometimes there'll be a back pain situation that's really just part of a bigger problem going on, some more generalized illness, some odd symptoms of fever or excess sweating, or just some intestinal type problems. Those are things, again, that require some medical attention, and those are not your typical mechanical back problems that you should try to figure out or experiment with on your own. And so these are just the scary things to throw right up front. And that's to kind of send the message, these are rare things that happen. But if there is something like that occurring, your regular doctor, or even if it's, if it's sudden, like an emergency department visit or urgent care visit, for those kinds of things would be warranted. Most back problems we see, and most back problems that exist, do not fall into these categories. So there, you get to the bulk of common back problems, and this is us taking the bull by the horns and trying to figure things out on our own. It's good to ask yourself, how did this start? Was there a specific moment of injury? Was there something I was doing differently, just in terms of usual habits around that time when it started acting up? That could be the beginning of problem solving. How do I potentially counteract or work against this? I should also add that it's good to consider, when did this start? And that could help to set your expectations about how quickly might this problem turn around. And generally for us, if we see a problem that's just developed within the last few days, the last few weeks, those things can be easy to figure out. Oftentimes we can find a feel-good strategy in the moment, and just as quickly as it started, we may be able to get strategies in place to help turn it around pretty rapidly. The same can be true of something that's been going on a few weeks or a few months, but once it starts to become a truly chronic problem, at least 3 months, and then sometimes we'll hear stories of a few years. The strategies that will help those problems, it may be a more gradual turnaround for sure, just as there's been some tightness or some weakness that may have really developed over time that takes time to turn around. Doing an inventory on yourself just about where you feel the symptoms is useful. If it tends to be right in the back and pretty even, pretty central, pretty symmetric, those things tend to be more straightforward. If there are symptoms off to one side or symptoms down into a leg, it still is possible for you to figure out and get back on track, but those things tend to be tricky. And those are just ways you could monitor the potential progress too. Generally, if we see symptoms coming out of the leg and becoming more of just a back problem, it's usually progress. It's not always a pleasant trade-off, like your back hurts more, but if your leg hurts less, you may actually be moving in the right direction, as opposed to the opposite trend. If you find that over time your symptoms are just becoming more and more widespread or further into the legs, then you're probably not on the right track, and getting some help to figure that out is probably warranted. When you have a problem like this in the back, sometimes it just feels like everything hurts, everything you do, and then somebody asks you at one of these appointments, what seems to aggravate most, and it's hard to make sense of. But if you can go through the list of usual positions and activities during the day and try to make some sense of it, that could help to guide you and a potential therapist or medical provider in figuring things out. And so bending, sitting, standing, walking, lying down, usually we'll see some variation with those positions. And depending on the pattern, it could give us some insight as far as what type of problem it could be, maybe give you an idea of ways you could move against those positions or movements to counteract. And then you also may already realize, there are certain things I can do to turn the pain off, or at least to shut it down or knock it down a few notches. And so if it's pain that's relieved with sitting, or pain that's relieved with walking, or pain that's only relieved with lying down, those are good things to sort of be processing through on your own if you're trying to figure it out, or if you're having someone else help figure it out with you. And so this is very oversimplified in a way, but the common problem that we see, maybe one of the most prevalent problems, is back pain associated with prolonged sitting or easily aggravated with repetitive bending. Life involves a lot of that sitting and bending forward and doesn't necessarily involve a lot of the opposite movement to keep things balanced. You can have simple problems that don't mean necessarily that anything is wrong with the anatomy, but these types of patterns with this pain, it could be the beginning of some disc bulging or even the beginning of a tendency for disc herniation in the joints of the lower spine. And so, it's not a perfect fit for everyone, but oftentimes some simple backward bending. So in the standing position, the lower right picture, that may be difficult at first, but if it does actually prove to free things up, like you feel like you can move further with repetition, that may be the strategy that starts to get things working right, so it actually helps your back to line up in a sort of a stacked position, and other function can improve as a result. Getting things working right, somehow breaking the cycle and restoring the right function, is often the path to getting things feeling right. It's just not always easy to do in that situation, when you're in pain and it's sort of scary to move. But if you have some context to it and some monitoring of the effects during these things, these are okay to experiment with. In those cases, being aware of your sitting posture is usually key. It's not the most exciting thing necessarily for us to talk about, but it's usually the most important. And you don't have to suddenly become perfect 100% of the time with your sitting, but to be up tall and fairly well supported most of the time can usually be a key ingredient in getting things under control. There's another picture on the bottom here of someone lying face down, propped on his forearms, trying to let the lower half relax into the position. That's sometimes a way to restore the normal curve and normal alignment in the spine, potentially a feel-good strategy. And these kinds of problems, especially some daily walking, it sounds like very generic advice, but it can be pretty powerful stuff just in terms of getting things moving and working out some of the stiffness that has developed. And so we may continue to talk about the monitoring of symptoms during these things, but basically to work through some pain that is consistent, the same with time in a position, or the same with time walking, or the same with each backward bend repetition. Consistent pain, the same each time, is okay and productive to work through. Something that really starts to smooth out or feel better the more you do, that is certainly a green light to continue that sort of thing. And then if you do experience, with these trials or efforts, something that is just worse and worse the more you try, without a doubt, worse through repetition, worse with time, especially if it's making symptoms spread further into your leg somehow. If you find that after something you've tried, it's much more of an effort, much more of a struggle just to get around, then that's overdoing it, and you actually need to consider an alternative. There is another common situation we see if the pain pattern is more consistent with standing and walking, then some forward bending strategies, simple movements in a chair, bending forward, or lying on your back and pulling the knees to the chest. Those may be enough to open joint space on the lower part of the spine and pull on some of the tight muscles, and again, counteract some of the aggravating activities. Usually in those cases, some sort of exercise where there's not a direct load on the spine, but you're getting general movement with some stationary biking or pool exercise can be worthwhile. And so then, these problems that are asymmetric with symptoms off to one side or into either leg, they get to be more tricky, and sometimes they're very hard to make sense of with the mechanical pattern of everyday activities. It could be some some upright extended positions are aggravating like walking, and some flexed and static positions like sitting are also aggravating. In those cases, it could be worthwhile to test the side-to-side mechanics in the back. And one of the exercises that has potential to be effective, but is also rather friendly and doable, is the one on your back. So you're lying on your back with your knees bent, keeping the upper body flat and letting the knees rotate to one side or the other. And again, these problems come in a few different varieties. Sometimes it's counterintuitive, but moving the knees toward the painful side can sometimes help things to line up better in the spine, and you find that to be a relieving strategy. But there also could be a sort of a tightness to one side, and moving the knees away, if it's a consistent stretch feel, that may actually be productive to work through. And so this is not giving you, the exact answer for every back situation, but some things that are worth a while to experiment and try. If you're doing that, if you're trying to manage it and find your own path out of it, it is good to monitor the symptoms, like we said, the location, the intensity, and during this trial period or experimentation, you'd want to have a reasonable frequency. Like if you were to use some of those strategies on the previous slides, it would be at least twice a day to see some potential change add up. The right movement for a new back problem is sometimes required every couple of hours for a few days, where that actually breaks the cycle and gets things working right. But experimenting on your own, again, probably at least twice a day to see if something adds up over the course of a few days in terms of relief or better function. And then the duration, you probably want to give these things a week or two. Giving it that time frame allows for sort of an honest assessment of what it's doing for you, if it's really the path out of the problem, or again, if maybe you need some additional help in figuring things out. And so, that gets to this point where if you've tried some of these things and you've tried other things on your own, maybe you've tried general exercise, which can sometimes be enough to break the cycle and get things moving, but you're just not finding the path, and it's proving to be a stalled problem that has you stumped. A couple of logical options for where to start. Your primary care provider, they would talk to you about the history of it. They'd want to hear the behavior of it. They'd put you through a basic physical exam to get a sense for what the problem is. Their skill is in managing the chemistry, so they would be potentially considering some medication options. Their skill is also in considering all the options that exist. So like, who might you need to be referred to? So that is one potential route. And then most people can actually start directly with a physical therapist. And I say most people, all people actually, but then by law, we're able to see anyone, and then it just becomes a matter of if there's reimbursement or insurance considerations. Most insurances are okay with people starting with a physical therapist, as long as we justify the need and then we can demonstrate some progress. And even Medicare, if we see someone initially, the obligation is then on us to send a report of our plan to your primary care provider or to some other medical provider as a way to keep them in the loop in case things need to go a different route if we're not figuring out the way out of it. But if you were to consider starting with a physical therapist, you could just double check with your insurance coverage and make sure that's okay. But we do see a lot of people who are self-referred or direct access, like we say. We also would start with a history and a basic physical exam, and our history would really try to dissect the behavior of the problem and problem solve through potential ways that we could categorize it, and then find strategies, maybe even within that first session, that help to reduce the pain, ways to get you moving right, so that things start to feel right, and really hopefully get you on the road to functional recovery. And so that, that is obviously what I do for a living. So my thought is that's a good fit for a lot of people, but you could start either way. And then there's a chance, we'd be working together to physical therapy along with primary care. There are other options that exist for sure. And to jump ahead to these initially is usually a mistake, just in that it can overcomplicate things, potentially confuse matters. And if you get too much information too fast from advanced diagnostics, and then there's intervention that's complex, like surgery or injections, too soon, it may be missing the boat, and it could be overcomplicating something that we could turn around with sparing you the time and expense of going through these stages. But that's not to say that these things are bad. These things are perfectly appropriate depending on where you are along the route of this pain problem. So sometimes a complicated problem, a spine medical specialist is the person to see if it has not responded to previous efforts, simpler efforts to get things better. We have some physical medicine and rehabilitation specialists who we work alongside with, and they are fantastic at looking at injection options and nerve block procedures and deciding, does this person really need to see a surgeon? But they're also fantastic at thinking about rehabilitation options. So whether it's physical therapy or a specific type of physical therapy or some alternative therapy, chiropractic or acupuncture, they can make referrals or recommendations there. When things are not improving, it is good to then get more information. Like if somebody really does need to go in with a procedure, an injection or a nerve block or a surgery, for sure, you would want to have the right imaging up front so it serves as the map for where to target with those things. And so that's where imaging is needed. And then also, just to go back to that, and one of those earlier slides, imaging is needed if you really suspect something is broken or dislocated or compromised in terms of the anatomy. Surgery, if things are not working in terms of nerve function, there's compression and function into the legs is disturbed, if it's causing specific weakness, in those cases, it may be surgery that's needed to decompress certain nerve roots. If somehow there's a part of the structure that's actually just not got its integrity and is collapsing in a way, those things are not very common, but that may be where surgical reconstruction of that area is needed. Beyond surgery, or actually beyond surgical decision-making, functional rehabilitation is sometimes the smartest route, where it could be a post-op rehab, or it could be, if you've gone through this route and then surgery is actually not smart, then working with a physical therapist again to have a different mindset for really improving the function so that you can do the things you want to do. That could be effective. And then there are pain problems like this that will drive you nutty, can be depressing for sure, and it's hard to cope with and figure out and how to manage, and some counseling along those lines, maybe even paired up with pain management where they look at longer term medication options. That's a route that some people will have to go. But, just to rewind, if you go right to these steps first, you may be missing the boat on something simpler that could have gotten you better. And so there are common conditions that you'll hear about. Sometimes we're able to identify exactly what the anatomic cause is, and sometimes these things can be more mysterious. Back pain of mechanical nature, where we're key players along with you to try to figure out how it behaves and what you can do to reverse the trend. But you'll often hear about degenerative discs or arthritis in the back, and that just refers to these intervertebral cushions. So between the blocks of the spine, over time, they will start to lose some of their height, some of their water content. And so if you're in your 20s and 30s, you'll probably have some mild degeneration that shows up on imaging. If you're in your 80s and 90s, it'll probably be more in the significant or severe, just in terms of the height of the disc that's lost. And so, that's just to send the message that the ages in between are often moderate changes. And most of us, once we're adults, will start to show some of this change in terms of the degeneration of the discs or the gradual disc height loss, which can lead to some narrowing of the joint structures and some narrowing of the nerve roots. Disc herniation is along the lines of what we hinted at earlier, where you can have a bulge. You can have a major herniation that starts to affect nerve roots. And so there we're looking for strategies to see if we could reduce it. But extreme problems like that may need more medical attention. And then spinal stenosis, that just refers to the narrowing around these nerve roots that go into the legs, and then also the narrowing of the central canal that could start to show up in terms of leg symptoms. And so, sort of an overview of the options that are out there for low back problems, things you could try, people you might see, and it may leave a lot of unanswered questions. And that's where, having a consult for certain problems can make perfect sense. But as far as, the agenda today, that was what I had prepared. And then this last slide, I'm always impressed by the support structures around the spine. And maybe not all of us look like this internally, but the misconception about the spine is that it's sort of a delicate structure, and also maybe that once things are wrong, you can't change them. But in terms of anatomy, it's pretty remarkable, the support structures around there. And then it's also pretty remarkable with these trends we see where the right kinds of strategies can change the function for the better. Not that we're just cars or automobiles with fixed metallic parts, but the right stresses, the right exercises can actually be a real powerful thing to get things to work better. So I know that takes us sort of up to the end of our time, but we do have a few minutes if there were any questions or anybody wanted to discuss here.
So Eric, I want to thank you for getting my picture up there. That's great. I don't know how you got the skin off, but thank you.
I turned your face around. That's all.
That's perfect. Thank you. Yeah. Eric, that was great. Thank you so much for that. While people here are thinking about some questions, and you can put them right in the chat there. I'll give you a moment to think of some stuff if you have questions. I just wanted to chime in on just a couple of quick things here. One is that there's a phrase that we use all the time in PT we say motion is lotion. And so many of the things that we find here with your typical back pain, a lot of it can be addressed with some of that gentle movement to get things going in the right direction. As Eric was mentioning, some things feel better when we're kind of moving, in a forward direction, some things feel better when we're in more backward direction. So with the PT's guidance, we can help to figure that all out and get you moving a little bit better for those of you who have acute or chronic back pain. The other thing that I was thinking about was when we were talking about all the different medical professionals who address back pain and you may go see, I think one thing, and I don't, and forgive me, I don't mean to get on a soapbox about coming to see physical therapists. That wasn't my real point here. But, we have the luxury of a little more time spent with our patients than most other providers. Um, in that time, there's a lot of hands-on assessment. We're actually touching the patient and moving you and assessing how things are moving, which in itself can be very therapeutic in try to figuring out what's going on. So it's diagnostic, but it's also therapeutic in nature as well. So when I'm assuming everybody here has some sort of back pain that they're interested in trying to figure some things out. So if you haven't seen a physical therapist, I would recommend reaching out, whether that's at UNC or someplace else. We're here as a service for the community at large. So please go, get the best help that's right for you. But I think Eric, you hit the nail on the head with so many of those points there. We did just have a question. I'm sorry. Go ahead, Eric. Were you going to say something?
I was going to say thanks, and I think you made some good points. I'll just throw in that most physical therapists really hate when people are not getting better. And so if you see one of us and we're going through the motions over a few visits and it's just not making sense, we'll actually help you to figure out where to go next to.
Absolutely. We did have one question that just came in on the chat, and I will say this is actually a pretty good question because it seemed to be an omission from that list of providers. And the question is, are chiropractors of any use? Where do they fit into the spectrum of plans of care?
Yeah, I think there are some great chiropractors out there. And the ones who are really good are going to look at your situation and do something very specific for what you need. And within a few sessions, really should have things turned around and have you back on track. But there are many bad chiropractors out there too. And the bad ones would be the ones who sort of do the same thing on everyone and maybe want you to sign up for like a lifetime plan. And so, it's worthwhile just to consider, usually with a newer problem, something definite that has, developed recently. A chiropractor can be key for getting things back on track, but it should not require a ton of visits. So they're not for everyone. It sort of depends on your taste, but they can be an option.
Yeah, I'd agree. There's some great ones out there, and then there's some not so great ones out there. It's all, manual therapy is very well documented as short-term relievers of pain and increasing of movement. So if it's not combined with the right therapeutic exercise and ways to manage on your own, well, then you're in for a pretty long plan of care that may have no perceivable end to it. So anyhow, let's see. So as we're waiting for any other questions to come through, I'm just going to go ahead and put in the chat one more time those links for our YouTube channel, where you can subscribe and you'll be actually notified when new videos become available, like today's, which will become available hopefully by tonight. And then also our Facebook page. So we have lots of events that'll be coming up and lots of good information that you can find there. So I do encourage you to visit our Facebook page and like us there as well. We've got one last question on there before we have to wrap it up today. we got two that came in. So one says, how do you find a good chiropractor? And then it was chimed in that somebody sees an osteopath who also does orthopedic manipulation, which has been incredibly helpful. So,
Yeah, I would say it's probably you find them by referral, and whether it's from your primary care or that physical medicine and rehabilitation group we have here. I think they they know of a network of reasonable chiropractors, and so it could be that you go through your medical provider to see if they have any recommendations. But yeah, I'm not sure. It is tricky to find a good one.
I agree. It's almost all word of mouth for the good ones. Ask the people that you trust. Ask your medical providers that you trust, and they'll help steer you down the right road. So I think we're coming up on the end of our time here. I want to thank everybody for attending our talk today. It was wonderful to see you all. We had wonderful numbers here. Our next Therapy Thursday is going to be on Thursday, May 23rd, I believe, 25th, whatever that Thursday is, 25th. And it's going to be surrounding women's pelvic health. So a topic that I certainly will not be leading, but we do have some wonderful people who are going to be talking about some very pointed topics in women's pelvic health. So be sure to join us there. It'll actually be here at that same exact link that you used today, but visit our Facebook page for more information there. All right. Well, thank you all for joining us. Thank you, Eric, for a wonderful presentation. And we'll hope to see you all soon. Thank you all. Have a great Therapy Thursday.
All right. See ya.